Hello student. Today, topic of lecture, the blood vessels system. Next question. The structure of the blood vessels, types of the blood vessels, types of the arteries, the vessels of pulmonary circulation, the arteries of systemic circulation, branches of the aorta and branches of the subclavian artery. Blood vessel system. Blood vessel system. Blood is transported in a tube system made of blood vessels. The blood vessels occurs macroscopically as a tubular network of arteries and veins which is distribute through the body. The naming of the blood flow in relation to the heart. The arteries transport blood from the heart to the periphery of the body, or the lungs and veins transport blood from the periphery of the body back to the heart. All arteries carry oxygen-rich blood. All veins carry oxygen-poor blood. Rich blood, very oxygen-poor blood. It's not correct for the pulmonary circuit, whose arteries carry oxygen-poor blood to the lungs for oxygenation. You see picture where you see this is arterial system, veins system. Arterial vessels, vein vessels transport blood in body. Arterial blood and venous blood. In this respect, arteries and veins principally have the same structure. The wall of the largest vessels consists from the inside to outside of three layers. Tunica intima, tunica media, tunica adventitia. Inner layers, middle layers, and outer layers. 3 layers. First layer, tunica intima. This flat endothelial cell layer is separated from internal elastic membrane by a basal membrane, basal membrane, basal membrane. The former is substantially stronger in arteries than in veins. Next, last, tunica media. Tunica media, a layer of coats of smooth muscle cells, which in case of arteries are of the elastic type, containing strong network of elastic fiber. The smooth muscle cells regulate the vessel's cross-section by contraction and thus resistant to flow. This is joined on the outside to the external elastic membrane. What you see, yellow color, elastic, internal elastic membrane, outside elastic, external elastic membrane, inner, internal and external. Tunica adventitia. Tunica adventitia. It contains collagenic connective tissue, which incorporates and anchors the blood vessels with a large diameter. Blood vessels run here for the blood supply of the vessels. What you see, this is blue and red vessels. It is vasa vasorum. Vasa vasorum. This is vasa vasorum. The passage of blood through the arteries proceed from elastic arteries to muscular arteries to arterioles. Elastic artery, what you see, wall of elastic artery, are largest arteries near the heart, the aorta, and its major branches diameters ranging from 2-5 centimeter to 1 centimeter. Their large lumen allows them to serve as conduit for conduction of blood between the heart and medium-sized muscular arteries. More elastin occurs in the wall of these arteries than in any other type of vessels, and the sheet of elastin in the tunica media and remarkably thick. The high elastin content in conduction arteries dampens the sugars of the blood pressure resulting from the rhythmic contraction of the heart. This is what you see: elastic artery aorta, tunica media, tunica intima, tunica externa. Tunica media is formed elastic fiber and smooth cells elastic fiber more than smooth muscle cell. And tunica intima, tunica externa, this is, you see, lumen. This is lumen. Vasa vasorum. For example, you see aorta. What aorta? This is elastic artery. Elastic artery. This is right coronary artery. This is muscular artery. Muscular arteries lie distal to the elastic arteries and supply group of organs, individual organs and parts of organs. They range in diameter from about 1 centimeter to 0.3 millimeter. They are called muscular because their tunica media is thicker relative to the size of the lumen than that of any other type of vessels by actively changing the diameter of the artery. This muscular layer regulates the amount of blood following to the organs supplied according to the specific needs of that organ. What you see, tunica, muscular artery. This is internal. This is intima. Internal elastic membrane. This is external elastic membrane. This is tunica media. Tunica media has many smooth cells. And this is, you see, tunica externa. Tunica externa. This is, you see, this is muscular arteries. This, for example, you see two arteries, artery ulna and artery radi. This is common palmar digital artery. What you see, artery. It is muscular artery. Arterioles are smallest arteries with diameter ranging from about 0.3 millimeter to 10 micrometer. Their tunica media contain only 1-2 layers of smooth muscle cells. Larger arterioles have all three tunics plus an internal elastic network in the tunica intima. Smaller arterioles which lead into capillary beds are little more than a single layer of smooth muscle cells spiraling around an underlying endothelium. What you see, arteriola, lumen, endothelium, and tunica media. Around arterioles located connective tissue. Next type of arteries, capillaries. What do you see, capillaries? are the smallest blood vessels with a diameter of the 8-10 micrometer, just large enough to enable erythrocytes. What you see, erythrocytes, to pass through in single file. They are composed of only a single layer of endothelial cells surrounded by basement membrane. They are body's most important blood vessels because they renew and refresh the surrounding tissue fluid with which all body cells are in contact. Capillaries deliver to this fluid the oxygen and nutrients cells need, and they remove the carbon dioxide and nitrogenous wastes that cells deposit into the fluid. This is capillaries. Capillaries supply body tissue through structure called capillary beds. A capillary bed is a network of body's smallest vessels. Capillary beds run through almost all tissue, especially the loose connective tissue. A terminal arteriole led arteriole led to meta-arteriole, red color. Into thoroughfare channel, vessels structurally intermediate between capillary and venula. True capillaries merge into the thoroughfare channel, which then join a venula. Smooth muscle cells called precapillary sphincters wrap around the root of each true capillary, where it leaves the meta-arteriole. This is precapillary sphincters, meta-arteriole, thoroughfare channel. This is capillary bed. This is sphincter open. Then precapillary sphincter regulate the flow of the blood to the tissue according to the tissue's needs for oxygen and nutrients. When the tissue is functionally active, the sphincter are relaxed, enabling blood to flow through the wide open capillaries and supply the surrounding tissue cells. When the tissue has lower demands, the precapillary sphincter contract, closing of the true capillaries and forcing blood to flow straight from the meta-arteriole into the thoroughfare channel and venula, thereby bypassing the true capillaries. In this way, capillary beds precisely control the amount of blood supplying a tissue at any time. This is, you see, when a sphincter open, blood flows through the true capillaries. This is, you see, sphincter closed, blood flows through meta-arteriolar thoracic channel and bypasses through capillaries. Even so, most tissue and organs have a rich capillary supply. Not all do. Tendons and ligaments are poorly vascularized. Epithelia and cartilage contain no capillaries. Instead, they receive nutrients indirectly via diffusion from nearby vascularized connective tissue, and the lungs have no capillary supply and they're nourished by the aqueous humor and other sources. Veins transport blood from the periphery of the body and the lungs back to the heart. Most veins are concomitant to arteries. They run parallel to corresponding arteries, accompanying veins. Overall, the course of the vein of much more versatile than the arteries and can show great individual variation. However, the large vein stems occur regularly in all people. Veins, together with capillaries and venulas, belong to the low pressure system of blood circulation. Since in the upright position, most veins have to transport the blood to the heart against gravity. The larger vein of the extremities and lower neck region have venous valves, which support the venous return flow. They ensure that the blood flow is only possible in direction of the heart. What you see structure of the vein, same to arteries, but only wall is very thin. For example, what do you see? Vein and artery. Vein accomplished. Artery, vein. Vein, artery. All this classification of the arteries. First, system classification. The arteries are classified according to the wall thickness into the following types: large arteries, medium arteries, small arteries. Next classification. The arteries are classified depending on the blood supply to the body wall or organ into the following type: parietal arteries and visceral arteries. Next, the arteries are classified depending on the localization of the organ into the following types: extraorganic arteries, intraorganic arteries. Next classification. The arteries are classified according to the name of the organ into the following types: splenic arteria, hepatic arteria, and other. The arteries are classified depending on the level of divergence into the following types: lower mesenteric artery, superior mesenteric artery. Next classification. The arteries are classified depending on the depths of location into the following types: shallow arteries, deep arteries. Lateral branches of the single trunk or branches of different trunk can join one another. Such junction of vessels before their division into capillaries is called an anastomosis. Anastomosis, for example. Most arteries form anastomosis. Arteries which don't anastomose with new boring trunks before they transform into capillaries are called end arteries. And arteries are more susceptible to thrombosis, the formation of blood clots, to infection, the local necrosis of an organ. Note you see, for example, you see anastomosis between left gastric arteria and right gastric artery and left gastric artery, anastomosis. This is, you see, left gastro-omental artery. This is left gastro-omental artery. This is right gastro-omental artery. This is anastomosis between artery. Next question, the vessels of pulmonary or lesser circulation. The pulmonary circulation begins as oxygen poor. Blood leaves the right ventricle of the heart via the pulmonary trunk. This larger artery exits the ventricle anterior to the aorta, ascend to aorta left, and reaches the concavity of aortic arch. There is branches and at a T-shaped divergence into the right and left pulmonary artery. Each pulmonary artery penetrates the medial surface of the lung and then divides into several lobes loba arteries, serving the lobes of the lung. 3 and right lung and 2 left lung. Or 2 lobes, 3 lobes, same loba. 3 in right lung and 2 artery in left lung. The pulmonary tract is covered with layer of pericardium up to its dividing point. Within the lung, the arterial branch, along with lung's air passageway, bronchi, as the branching arteries decrease in size. They become arterioles, and finally the pulmonary capillaries that surrounded the delicate air sacs. Lung alveoli. Gas exchange occurs across the capillaries, and the newly oxygenated blood enter venules, and then progressively larger vein. The largest venous tributaries form the superior and inferior pulmonary vein. What you see, pulmonary vein, superior pulmonary vein left, inferior pulmonary vein left, and same superior pulmonary veins right. This inferior pulmonary vein right. Superior and inferior pulmonary vein exit the medial aspect of the each lung in the mediastinum posterior to the heart. The 4 pulmonary vein run horizontally just inferior to the pulmonary arteries. Just inferior to the pulmonary arteries and empty into left atrium. This is 4 pulmonary vein. Pulmonary vein. This is left atrium. This is foramen. Pulmonary vein. Arteries and veins of the pulmonary circuit have thinner walls than do systemic vessels of comparable diameter, reflecting the fact the maximum arterial pressure in the pulmonary circuit is much lower, only 1/6 of that in systemic circuit. The pulmonary veins are not completely isolated from the veins of systemic circulation because they anastomose with the bronchial veins draining into vena azicus. The pulmonary veins have no valves. What you see, pulmonary trunk, lung, lobes of lung. This is heart. You see pulmonary vein. What you see pulmonary vein, and you see branches of pulmonary artery. Pulmonary artery. You see what right pulmonary artery, and right pulmonary vein, artery, vein. This is left, you see left pulmonary vein. Lung. The arteries of systemic circulation. The aorta. The aorta, the main arterial trunk of systemic circulation, carries blood from left ventricle of the heart. The aorta leaves the heart. Arcs superior, and then descends along the badges of the vertebra to the inferior part of the abdomen. Along this course, the aorta divided into the following three parts: pars ascendens aorta, arcus aorta, pars descendens aorta. Three parts: pars ascendens aorta, arcus aortae, and pars descendens aorta. Descendens aorta, this is mistake. Ascendens arcus y descendens. Pars ascendens aorta. Pars ascendens begins as marked bulbus expansion, bulbus aortae. Within the distension are three sinus of the aorta. Sinus aortae, found between wall aorta and the cusps of the valve. valve. The branches of the ascending aorta are the two coronary arteries that supply the wall of the heart. The ascending aorta is approximately 6 centimeters long. Behind the manubrium of the sternum, the ascending aorta is continuous with the arcus aorta. This is pars ascendens, arcus aorta. Arcus aorta. What you see? Arcus aorta, aortic arch. 3 arteries branch from aortic arch and run superiorly. The first and largest branch is the brachiocephalic trunk, truncus brachiocephalicus, which ascends to the right toward the base of the neck, where it divided into the right common carotid, arteria communis caroticus dextra, and arteria subclavia dextra, and right subclavian arteries. It is truncus brachiocephalica, divided in 2 branches, arteria communis caroticus dextra and arteria subclavia dextra. The second and third branches of the aortic arch are the left common carotid, the arteria communis caroticus sinistra, and arteria subclavia sinistra. These 3 branches of the aorta supply the head and neck, upper limbs, and the superior part of the thoracic wall. 3 branches of the aorta. This is truncus brachiocephalica, arteria communis caroticus sinistra, arteria subclavia sinistra. 3 branches. What you see? Truncus brachiocephalica. This is arteria communis caroticus dextra, arteria subclavia dextra. This is arteria communis caroticus sinistra. This is dextra, sinistra. Arteria subclavia sinistra. What you see? Arcus aorta. Three branches of the arcus aorta. And you see, this is descendens aorta, thoracic part, diaphragma. Next part, pars descendens aortae. Continuing from the aortic arch, the descending aorta run runs posterior to the heart and inferiorly on the bodies of the thoracic and lumbar vertebra to the level of the hiatus aorticus. The descending aorta is called the thoracic aorta, pars thoracica aortae. Below the hiatus aorticus, when the aorta is already in abdominal cavity, it's called the abdominal aorta, pars abdominalis aorta. What you see, pars thoracica aorta, pars abdominal aorta. Together pars descendens aorta. On a level with the first lumbar vertebra, it gives off two large lateral branches, the common iliac arteries, bifurcatia aortae, and then continues into the pelvis as a small thick trunk. This is the absent. This is arteria sacralis mediana. This is absent. Pars abdominal aorta, bifurcatia aorta, and form common iliac artery dextra, iliaca communis sinistra, arteria iliaca communis sinistra, arteria iliaca communis dextra. This is pars abdominalis aorta, abdominal aorta. Branches of the arch of the aorta. The brachiocephalic trunk. The brachiocephalic trunk, about 3-4 cm in length, is a remnant of embryonic right ventral aorta. It runs obliquely upward and to the right anteriorly of the trachea, where it divides behind and the right sternoclavicular joint into its terminal branches, the right common carotid and right subclavian arteries. This is truncus brachiocephalica. This is arteria communis caroticus dextra, arteria subclavia dextra. The common carotid artery located in anterior triangle trigonum caroticum, just deep to the sternocleidomastoid and relatively within infrahyoid muscle. These vessels are more vulnerable than most other arteries in the body because their relatively superficial location makes them vulnerable to slashing wounds. At the superior border of the larynx, the level of the Adam's apple, each common carotid ends by dividing into external and internal carotid artery. External and internal carotid artery. External carotid artery. Arteria carotis externa. The external carotid artery supply blood to the external part of the head and neck. From its point of origin, the external carotid artery runs upward. What do you see? External carotid artery. This is internal carotid artery. The branches of external carotid arteries are divided into three groups: anterior, middle, and posterior group. Anterior group. It is the superior thyroid artery, arteria thyroidea superior, supplies the thyroid glands and larynx. Next, the lingual artery, arteria lingualis, supplies the tone. The facial artery, arteria facialis, supplies the skin and muscles of anterior face. What do you see? Arteria facialis. Arteria facialis. Arteria lingualis. And arteria thyroidea superior. All three artery. Anterior group. Posterior group. The occipital artery, arteria occipitalis, supply the posterior part of the scalp. Next artery, posterior auricular artery, arteria auricularis posterior. Supplies the region around the ear. And next artery, the sternocleidomastoidea, supply musculus sternocleidomastoidea. This is posterior group. The arteria occipitalis, arteria auricularis posterior, arteria sternocleidomastoidea. Posterior group. Anterior group. Posterior group. Artery. And next middle group. Include the ascending pharyngeal artery, pharyngeal ascendens, and the superficial fascial temporal artery, arteria temporalis superficialis supplies the ear and scalp, and maxillary artery, arteria maxillaris, the maxillaris supplies the teeth, the cheek, nasal cavity, and muscles of mastification. A middle group. It is branches of arteria communis external. Internal carotid artery, arteria carotis interna, supplies the orbit and most of the cerebrum. Each internal carotid ascendens through the superior neck, directly lateral to the pharynx, and enters the skull through the carotid canal in the temporal bone. From there, it runs medially through the petrous region of the temporal bone, runs forward along the body of the sphenoid bone, and bends superiorly to enter sella turcica, just posterior of the optical canal. Here it gives off the ophthalmic artery to the eyes, eye and orbit, and divides into anterior and middle cerebral arteries. The internal carotid artery has next part: pars cervicalis, pars petrosa, pars cavernosa, pars cerebralis. То есть pars cervicalis, pars petrosa, pars cavernosa, pars cerebralis. Internal carotid arteries. You see arteria communis caroticus, and you see external arteria caroticus external. What you see this? And arteria caroticus internal. Pars cavernosus. This is pars petrosus. This is pars cervicalis. Internal. Arteria caroticus internal. This is, you see, external. No, you see, this is arteria facialis. Arteria facialis. Arteria maxillaris. Sorry. Each anterior cerebral artery anastomosis with its partner on the opposite through a short anterior communicating artery. Sorry. What you see, internal carotid artery, it is pars cerebralis. Pars cerebralis. Pars cerebralis branches anterior cerebral artery, cerebral artery. Each anterior cerebral artery anastomoses on the opposite through the short anterior communicating artery. Communicated. You see anterior cerebral artery. You see this artery connect with help communicating artery. Arteria communicans anterior. And supply anterior cerebral artery supplies the medial and superior surface of the frontal and parietal lobes. Each middle cerebral artery, arteria cerebri media, arteria cerebri media runs through the lateral fissure of the cerebral hemisphere and supply the lateral part of the temporal and parietal lobes. Next, posterior cerebral artery branches off from arteria carotis interna. On the short length of the latter after its gives of the orbital artery. It then passes back and drains into a cerebri posterior from arteria vertebralis. You see branches posterior communicating artery from internal carotid artery with posterior cerebral artery. Posterior cerebral artery runs from arteria vertebralis. Arteria vertebralis connects and from arteria basilaris. Together, the anterior and middle cerebral arteries supply our 18% of the cerebrum. The rest of the cerebrum is supplied by posterior cerebral artery. In the subarachnoid space, communicans the beginning segment of the arteria cerebri anteriors and arteria communicans posterior and cerebri posterior. Arteria cerebri posterior from arteria vertebralis joined to form a close arterial circle, a circulus anteriosus cerebri, Willis circle. Next artery, arteria subclavia artery, artery subclavia. the left subclavian artery belong to the group of arteries branching directly of the aortic arch. The artery on the right is a branch of truncus brachiocephalicus. The right subclavian artery, is slightly shorter than the left. The artery forms a convex arch curving around the cupola of the pleura. It leaves the thoracic cavity through the aperture superior, approach the clavicle, and feed into clavicle and fit into the sulcus of arteria subclavia of the first rib and bend over it. Here, the artery subclavia may be compressed to stop the flow of the blood of the first rib behind the tuberculum of musculus scalenius. Musculus scaleni. This point point to stop the flow of the blood to the first rib behind. What you see, musculus scalenius, anterior, medius and posterior. Artery proceed further into the axillary fossa, where beginning with the external edge of the first rib. It has been given the name arteria axillaris. Along the way, the subclavian artery, together with brachial plexus nervosus, passes through the sputum interscalenium. This you see sputum interscalenium. Those three segments can be distinguished in the artery. The first, from the beginning of the artery to the entrance into the sputum interscalenium. The second in the sputum interscalenium, and the third from its exit to transition into arteria axillaris. The three segments of artery subclavia. This is first to the entrance into sputum interscalenium, second in the sputum interscalenium, and the third from its exit to transition into arteria axillaris. First, second, and first, second, third part, the segment of artery. First segment, this is second segment, and third segment. From first segment branches form branches arteria vertebralis and costocervicalis trunk, and thyrocervicalis trunk and costocervicalis trunk, and you see axillary artery. The branches of the first segment of subclavian artery. Subclavian artery. The vertebral artery, arteria vertebralis. The first branch reflects upward into the interval between musculus calcaneus anterior and musculus longus colli, passes into the foramen transversarium of the 6 cervical vertebra and rises through the opening in the transverse processes of the cervical vertebra to the membrane atlanta occipitalis posterior, which it perforates to the end of the cranial cavity, through the foramen magnum of the occipital bone. We see in the skull vertebral arteries from the both sides pass toward to median line and form a single unpad artery, arteria basilaris, near the posterior edge of the pons. What you see? Arteria vertebralis and arteria basilaris. Arteria basilaris. Along the way, this artery gives off small branches to the muscles, the spinal cord and diramata, and the posterior cranial fossa, and well as the large branches, arteria spinalis anterior, arteria spinalis posterior, arteria cerebelli inferior posterior. Next, the basilar artery ascendens along the ventral midline of the brain stem sending branches to the cerebellum, pons, and inner ear. At the bottom of the pons, at the midbrain, it divides into the pair of the posterior cerebral arteries, which supplies the occipital lobe plus inferior and medial parts of the temporal lobes and cerebral hemisphere. Next, the truncus thyrocervicalis branches upward from arteria subclavia at the medial margin of musculus calcaneus anterior. The trunk runs for a distance of about 4 mm and then divides into the following branches: arteria thyroidea inferior, arteria thyroidea inferior, arteria subclavia, and arteria transversa cervicis. It is truncus thyrocervicalis. What you see? Arteria thyroidea inferior, arteria suprascapularis, e arteria transversa cervicis. This is truncus thyrocervicalis. Next, the internal thoracic artery, arteria thoracica interna. Branches from the subclavian artery superiorly, then descendants just lateral to the sternum and just deep to the costal cartilage. Anterior intercostal arteries, branches of regular interval and run horizontally to supply the ribs and structure in the intercostal space. The internal thoracic artery also sent branches superficially to supply the skin and mammary gland, and inferiorly at the costal margin, where it divides into a branch to the anterior abdominal wall and branch to the anterior part of the diaphragm. Arteria thoracica interna. What you see? Arteria thoracica interna. This is subclavia truncus thyrocervicalis. This is arteria thoracica interna. When arteria thoracica interna reaches the lower edge of 7th rib cartilage, it divided into two terminal branches: arteria musculophrenic and arteria epigastrica superior, which anastomoses with arteria epigastrica inferior from arteria iliaca externa. Arteria thoracica interna gives off branches to the nearest anatomical formations to the connective tissue of the anterior mediastinum, thymus, lower end in the trachea and the bronchi, to 6 upper intercostal space and the mammary glands, the diaphragm, the pleura, and pericardium and sternum. The branches of the second segment of the subclavian artery. The truncus costocervicalis. Branches to the sputum interscalenium and passes back and up to the neck of the first rib, where it divided into two branches: deep cervical artery, arteria cervicalis profunda, which penetrate the posterior muscles of the neck and gives off small branches in the canalis vertebralis to the spinal cord, and superior intercostal artery, arteria intercostalis suprema, which branches into the first and second intercostal spaces, arteria intercostalis anterior branches, and rami spinalis. The truncus costoversalis divides into two branches: deep cervical artery, arteria cervicalis profunda, and the second branches, arteria intercostalis suprema. What do you see? Truncus costocervicalis. Today, lecture is finished. Thank you for attention, student. Goodbye.